I'll give you a couple of potential examples. One is the use of PET radio tracers labeled with fluorine-18 to image amyloid in the brain. Amyloid is, of course, felt to be the underlying contributing cause of Alzheimer's disease. Currently, Alzheimer's disease can only be diagnosed by the clinical history and exam. There's no biomarker or lab test for Alzheimer's. As you heard, you can't do a brain biopsy. So the diagnosis is often imprecise and sometimes made late. With amyloid imaging with PET, you can make a much more precise diagnosis. Now, at least currently, there unfortunately are not very many effective or any effective preventive therapies for Alzheimer's or even treatments to reverse the course or stabilize it. However, PET imaging of amyloid can be used in therapeutic trials of drugs meant to be effective in Alzheimer's disease. For example, if you have many individuals have something called a mild cognitive impairment, which is an isolated difficulty with memory, but they don't have full-blown symptoms to make a clinical diagnosis of Alzheimer's. So if you're doing a therapeutic trial of a drug meant to, for example, wash out amyloid from the brain or prevent its formation or perhaps stimulate the regeneration of neurons, you'd want to select patients who you knew had amyloid in the brain from those group of subjects who just have mild cognitive impairment. Because in fact it is known that approximately half of patients with that picture of mild cognitive impairment, just some mild memory difficulty, will go on to develop full-blown Alzheimer's. So those are the ones who should be participating in clinical trials of anti-Alzheimer therapies, and those are the ones who, should those therapies work, should have an amyloid scan to show that they are good candidates to receive that therapy.